This week, the World Health Organization and its research arm, the International Agency for Research on Cancer, released a landmark global analysis showing that a large proportion of cancers diagnosed around the world could have been prevented. This is the first time a global study has systematically quantified how much of the worldwide cancer burden is linked to causes that we can change, reduce, or eliminate. Hi, my name is Soumya Pillai, and in this episode of Pure Science, I will help you unpack the findings of this report. The researchers looked at data of 36 different cancer types across 185 countries, covering nearly every region of the world. They analyzed 30 risk factors that are considered at least partially modifiable, meaning they result from behaviors, exposures, or conditions that can be changed through public health policy, individual lifestyle choices, or healthcare interventions. These include well-established contributors such as tobacco smoke, alcohol use, infections known to cause cancer, and environmental exposures like air pollution, ultraviolet radiation, and occupational hazard. The headline finding from this analysis is quite striking. It says that around 37 to 38% of all new cancer cases in 2022, which is approximately 7.1 million of the 18.7 million diagnosed worldwide, were linked to preventable causes. In other words, nearly 4 out of every 10 cancers could potentially be avoided if harmful exposures were reduced or prevented. At the top of the list of preventable risk factors is tobacco smoking. The study found that tobacco use was responsible for about 15% of new cancer cases globally. Tobacco contains hundreds of carcinogenic chemicals that damage DNA, promote inflammation, and disrupt normal cellular processes, leading to cancers in the lung, throat, mouth, pancreas, bladder, and other organs. The second largest preventable contributor was cancer-causing infections, which accounted for roughly 10% of new cases. For the first time in a global analysis like this, researchers explicitly included 9 infectious agents known to cause cancer. These include viruses like the human papillomavirus or HPV, which is the cause of nearly all cervical cancers, hepatitis B and C viruses, which can lead to liver cancer, and Helicobacter pylori, a bacterium that significantly increases the risk of stomach cancer. Effective vaccines exist for both HPV and hepatitis B, and antibiotic treatment can eradicate Helicobacter pylori, making infection-related cancers a critical target for prevention efforts. Alcohol consumption was the third leading modifiable risk factor, linked to about 3% of new cancers globally. Alcohol is classified by the International Agency for Research on Cancer as Group 1 carcinogen, meaning there is strong evidence it causes cancer. The body metabolizes alcohol into acetaldehyde, a chemical that damages DNA and interferes with cellular repair processes. Alcohol contributes to cancers of the liver, breast, colon, esophagus, and other organs. Beyond these 3 major contributors, the study also highlights other preventable factors. These include high body mass index, physical inactivity, poor diet, air pollution, ultraviolet radiation from the sun and other sources, and occupational exposures. While each of these contributes a smaller share individually compared with tobacco or infections, collectively they add to the global preventable cancer burden. When the researchers looked at cancer types, they found that 3 cancers accounted for nearly half of all preventable cancer cases globally: lung cancer, stomach cancer, and cervical cancer. Lung cancer, the world's most deadly cancer, was mainly linked to tobacco smoking and air pollution. Stomach cancer was largely tied to Helicobacter pylori infection, and cervical cancer was overwhelmingly caused by HPV infection, which can be largely prevented through vaccination. The study also revealed important differences between men and women. Among men, about 45% of all new cancer cases were linked to modifiable risk factors, compared with about 30% in women. In men, smoking was the dominant factor, followed by infections and alcohol. In women, infections were the largest preventable cause, followed by smoking and high body mass index. There were also regional differences in preventable cancer burdens. For example, the proportion of preventable cancers in women ranged from as low as about 24% in North Africa and West Asia to nearly 38% in sub-Saharan Africa, reflecting the difference in infection prevalence, healthcare infrastructure, and access to preventive care. Among men, preventable cancer was highest in East Asia at about 57% and lowest in Latin America and Caribbean at about 28%. These contrasts highlight how local exposures, cultural behaviors, prevention policies, and healthcare access shape cancer risk around the world. Experts say that the new analysis underscores how much of the global cancer burden is linked to exposures and behaviors that can be changed, and why prevention must be a central part of global cancer control. Tobacco control measures such as higher taxes, advertising bans, and smoking cessation support have proven effective in reducing smoking rates. Vaccination programs for HPV and hepatitis B can prevent infection-related cancers. Policies to reduce harmful alcohol use, improve air quality, encourage physical activity, and promote healthy diets can further reduce cancer risk. Occupational safety regulation can limit harmful exposures in workplace. According to the study's authors and WHO officials, addressing these preventable risk factors is one of the most powerful opportunities to reduce global cancer incidence and mortality. It shifts part of the focus from treating cancer after it develops to stopping many cases before they even start. Coordinated action across sectors, including health systems, education, policy, and community programs, is crucial to turn this potential into measurable reduction in cancer burden worldwide. That was all from me this week. I am Soumya Pillai, and you were watching Pure Science on The Print.